our shows on a Saturday morning, but Alhamdulillah, we are back to our normal times, and Alhamdulillah, I think everyone enjoyed themselves yesterday, having post-Eid fatigue. Finished all the leftovers today in the kitchen for for lunch and supper. And Monday, you also had leftovers from yesterday. Yeah. Anyway, we'd like to welcome my guest in the studio today, Dr. Mark Moodley, a very well-known pediatrician here in the Durban and KwaZulu-Natal region. He needs no introduction. He's quite an expert when it comes to behavior and things like ADHD and autism, and he's had quite a few shows here on radio at Medical Files. So if anybody has any sort of questions, even if it's not relating to our topic, which is autism, the autism spectrum, anything to do with ADHD or things like that, I'm sure he won't mind answering those questions. If anybody has any queries or any questions, they can send it through on our WhatsApp channel. It's 060-904-1056. That number again is 060-904-1056. Doc, warm welcome to you. And tell us why such huge confusion when it comes to autism. Just as an introduction, tell us, why do people still in this day and age not familiar with what autism is, after all the awareness and all the shows and things like that have been around? What is it about autism?
Yeah, good evening. It's good to be on the show. So why the confusion? Because autism is a spectrum and children are presenting differently. You would get one child that conversates 100% and another child that is non-verbal, totally non-verbal. So the variety in presentations is quite different, and that is causing a lot of confusion. There's also a lot of stigma attached to it. People are not accepting the diagnosis. So April is Autism Awareness Month, and tomorrow being the 2nd of April, World Autism Day. So hopefully having these shows and awareness programs that we can try to eradicate the confusion that's arising.
Okay, and a lot of people do confuse autism with ADHD, and sometimes when a child is just very naughty, they just say, "Oh, yeah, probably autistic," or things like that. How common is autism?
So autism, So
okay, before we go on to that, let's discuss what is the autism spectrum disorder.
Okay.
Yeah.
Autism spectrum disorder is a neurodevelopmental disorder. So we're looking at developmental milestones, and we specifically looking at speech and communication. That's where the deficits lie. This could be, when I speak about speech and communication, it could be verbal and non-verbal. There's deficits in interactions, play, and behavior. Symptoms generally present prior to 3 years of age. However, some cases will be picked up later. And changes can occur with age and development as a child grows older. As I said, it is a spectrum now, and we have labeled it as one diagnosis, the autism spectrum disorder. And everyone on the spectrum is different. No two autistic kids are similar. There was a saying by somebody called Sinclair in 1993 that said, "Autism is a way of being. It colors every experience, every sensation, perception, thought, emotion, and encounter, every aspect of existence." In South Africa, identification of children at risk and early intervention is initially more important than making a diagnosis.
From what you've described, it seems like it's quite a complex series of things, and can be difficult to diagnose, firstly amongst doctors like GPs. So I can just imagine, in general, parents. And because there's no understanding of what it is, a lot of parents, like you say, will be in denial. They wouldn't want to accept it. In my experience, I found most of the autistic children are more withdrawn. They're more, aloof. They don't want to participate in anything that's going on. They feel very frightened. They don't want to actually be a part of whatever is going on there, especially when they come to the surgery. And, it's the first time we're seeing the patient as a general practitioner, and, they're feeling scared, and the mom is busy hitting them and telling them, come on, what's wrong with you? You're at the doctor now, let the doctor see you and everything. And then we got to sit down and tell them, what, actually, this child is showing signs of autism and things like that, And the first reaction is, how do you know that? And then we tell them, well, this is something that we've experienced a lot in practice. And then the first question they ask is, okay, so now what do I do now? And I'm sure that that happens to you as much as it happens to us as well. So how common is autism actually in our community?
Yeah, if we go years back, generations back, a lot of cases were being picked up back then. Looking at current statistics, we're looking at, this is quite alarming. We're looking at 1 in 36 children that's on the autistic spectrum disorder, and it tends to affect more males than females. So 1 in 36 is quite alarming. So that's the prevalence.
Okay, so you did mention that this month is an awareness month for this type of disorder. How is South Africa when it's compared to the rest of the world when it comes to acknowledging and identifying this type of disorder?
Yeah, in South Africa, so basically, we have different cultures, different heritages. There can be a lot of sort of lack of knowledge about the condition, especially when it comes to culture and tradition. We are a multi-diverse country. And if you look at a child with autism spectrum disorder, it is a social disability. So there could be a lot of stigma attached to it. Because of limited resources, there could be less kids that's been diagnosed. Looking at first world countries, there might be more experts trained at diagnosing these kids, more training for healthcare professionals, and maybe more openness to the diagnosis. It has a lot to do with culture, with heritage, and South Africa being multi-diverse, lack of knowledge. So that tends to be a problem, and that's why we need to raise awareness.
Okay, so tell me a little bit about the clinical presentation. What's the presentation in most cases? I know it varies, not the same.
Yeah, so the clinical presentation, so we're looking at 2 parameters. We're looking at speech and communication as one, and then we're looking at stereotypical, restrictive, repetitive behavior as the other domain. So when we're looking at speech, these children could present with speech delay. They could have atypical speech. They may repeat what you say, which we call echolalia. They have a sing-song quality to their speech as well. Some of these kids are verbal. They communicate quite well, but they don't communicate like in a to and fro conversation, like sort of a functional conversation. They have very poor non-verbal communication. I mean, by eye contact, facial gestures, body language, pointing, and then we get stereotypical repetitive body movements. You can see them hand flapping, rocking, swaying, dipping. And one of the core symptoms will be a child that's toe walking. Around 2 years, you'll see the toe walking. They tend to line up their toys when playing. You see there's a lot with the building blocks with toys. Motor mannerisms, more in the preschool children, they have self-stimulating behavior, self-injurious behavior, for example, head banging, face slapping, self-biting, and self-pinching. The self-injurious behavior, if it's new onset in a child, if the child hasn't been doing this before, we should always consider, because a lot of these kiddies are not verbal. Is this child in pain? Is there discomfort? Or is there an underlying infection that the child may not be able to verbalize to you? These children, they are very resistant to change. They love routine. And when you change their routine, they can become very aggravated and upset about it, similar to an obsessive compulsive disorder pattern. And they can present with a meltdown. A meltdown is not a temper tantrum. A temper tantrum is basically a child using his way to manipulate a situation to get what he or she wants. An autistic child has a meltdown because they are not verbal, they are sensory overloaded, and they need to compensate in that way. They have a preoccupation with unusual objects. we've seen stones, sticks, staples, newspapers, which they can collect with them, take to bed with them. Weather, dates, phone numbers, license plates. Some of them love dinosaurs, an obsession with dinosaurs, dogs, planes, ceilings. I've seen that a lot. Fans, vacuum cleaners. And the other element is sensory. So taste, smell, touch, and hearing. Some sensory factors can be overstimulating for the child, and some may be understimulating. So you might find a child coming to you and hugging you excessively, or a child that may not want to be touched. If there's a sound, a loud sound, the child might block his ears. They may smell stuff, taste stuff, or they might not want to eat something because of the taste or the texture of the food. And some of these kiddies may have a head size that's bigger than normal. We see that in about 25% of our kiddies.
Okay, and at what age should we start looking for these signs and symptoms? Usually, is it before they can talk or after that?
Yeah, so if a child is not speaking by 18 months, that should be a red flag. We do have screening tools for the child. So the recommendations, 18 months, 24 months, all children do a screening test and see, then we can pick up the cases early. Like I said, it's not a matter of diagnosing the child, but picking up the condition early and starting speech therapy and occupational therapy, because early intervention has been shown to improve the outcome of the child.
Okay, and when you speak about these clinical presentations, does it fall under a spectrum of a mild, moderate, high, or is it just one glove fits all? Or do you get, is there such a thing as mild autism or a severe autism, or is it just autism?
Yeah, so we do hear parents speaking about mild and severe. So autism spectrum disorder basically is a collection of all the autisms, but we do get levels of it: level 1, level 2, and level 3. With level 1, a child needing some support, and level 3, a child needing very substantial support.
Okay. Reminder to all our listeners out there, we've got, I think hopefully we're having the whole country listening to us, our listeners from Radio Al Ansar International, IFM, Radio Islam International, Channel Islam International, Voice of the Cape, Radio 786 and Sirius FM. Reminder to you all that if you have any type of question, no matter what it is regarding this topic, we have an expert here, Dr. Mark Moodley, a pediatrician. You can please send a message through on 060-904-1056. That number again is 060-904-1056. Okay, so from what I gathered you discussed so far, there's a lot of elements of OCD or obsessive compulsive disorder there. So how would how would you be able to tell the difference, and what conditions are there that coexist with this?
Yeah. So the common conditions that we see is anxiety. These children have excessive worry over everything. They could have a rapid heartbeat, sweating, night terrors. One of the most common conditions coexisting is attention deficit and hyperactivity disorder, ADHD, which can overlap with symptoms of autism. Oppositional defiant disorder. This is a child that's not afraid of authority figures. Conduct disorders. Depression. This is a child with low mood, may have loss of appetite, poor sleeping patterns, loss of interest in activities, which we call anhedonia. Tic disorders, which is abnormal movements of which can be vocal or motor, abnormal movements of their hands, which they cannot control. Psychotic disorders. Doc, I'm sure you've seen a lot in adult schizophrenia.
Okay, we're just going to take a short break. We'll be back after these messages.
A single thread is fragile, but woven together, it can become unbreakable. This Ramadan, weave the threads of generosity with the Al Imdad Foundation. Your support helps provide food hampers to families in need across 40 countries globally. Every meal is a stitch of hope pulling the Ummah closer. Sponsor a hamper for just 800 Rand and help strengthen the fabric of our global community. Donate at alimdad.com or call 0861 786 243. Together, let's weave a stronger, more generous Ummah this Ramadan. I learned my lessons all through you.
It's official. Checkers Foods Kawi Park is our first food store with a halal butchery, bakery and deli certified by NIHT, the National Independent Halal Trust. This will ensure high standards and ethical practices across our butchery, bakery and deli from farm to table. So visit Checkers Foods Kawi Park for an exceptional shopping experience that keeps getting better and better.
Education, health, dignity, empowerment. These wishes all begin with water. Africa Muslims Agency is committed to providing clean water to the thousands who still live without this basic human right. Support us in giving the best of charities. Provide a water well for 16,500 Rand or a borehole for 55,000 Rand in Afghanistan or 65,000 Rand in Africa. Gain Thawabi Jariyah and help communities to reach their full potential. Africa Muslims Agency, empowering, educating, inspiring.
Looking for top quality tools and hardware at unbeatable prices? WhatsApp us at 081 450 6082 or shop online at hyperhardware.co.za. For fast, reliable service, we deliver nationwide.
Running a business is tough. Managing labor issues, even tougher. That's where Viva Labor Consultants comes in. For 18 years, we've been South Africa's trusted partner in labor law compliance. From UIF to workmen's compensation and MIBCO registrations to CCMA hearings and trade union negotiations, we've got your back. Based in Durban, our team is ready to assist. Call Zainade today for free consultation on 082 501 0012 or visit us at vivalaborconsultants.co.za. Viva Labor Consultants, your labor law experts, always by your side.
Hajj Seminar 2025 will take place on Saturday, the 12th of April at 207 West Road in Overport. Speakers include Qari Naeem Sheikh, Madrasa Aisha Siddiqa, Hafiz Ismail Kovadia, Sahuk, Head of Mission, Maulana Ahmed Mohammadi, Amir of Jamiyat al-Ulama KZN, Maulana Habib Milanzi from the Sunni African Ulama Council, Mufti Farooq Sufi from Habibia Sufi Sahib Masjid, Mufti Advocate Imran Vauda, Maulana Muhammad Vanka, Imam of Amshlanga Masjid, Maulana Junaid Kirsani, Mufti Ismail Basa, Director of the Al-Burhan Institute, Mufti A.K. Hussain, Amir of Markaz Sahaba Radio, Maulana Ibrahim Muhammad from the Sunni Jamiyat al-Ulama. Rules and regulations for females during Hajj by Muallima Ansar Mia. Program director will be Hafiz Hussain Wadi. Program commences at 7:15 a.m. and will culminate at Zohar with a scrumptious lunch. That's Saturday, 12th April 2025 at 207 West Road. Proudly brought to you by the Al Ansar Foundation and the Capital Group of Companies.
Radio Al Ansar, 24/7, 365.
Welcome back to Medical Files on this Tuesday, the 1st of April, at our normal usual slot between 8 and 9. We have in the studio today Dr. Mark Moodley, a very well-known pediatrician here in Durban, needs no introduction. And for those of you that just joined us, our topic today is the autism spectrum. We've been discussing the fact that it's World Autism what is it? The Identification Week, or being able to awareness. Yeah. And we've discussed how common autism is. We've discussed the spectrum of the disorder, and we were busy discussing conditions that coexist. You mentioned ADHD, OCD. You can continue with that.
Doc, I was saying. You're seeing the adults as well, so you're seeing cases of schizophrenia where they have hallucinations, delusions, psychotic disorders. They can have coexisting learning difficulties, and one of the other disorders will be an underlying epilepsy. So these can all coexist together with your autism spectrum disorder.
Yeah, as I can see here, it says World Autism Acceptance Month. So is it something that Is there a problem with people accepting it? Are they talking to non-autistic people accepting people who have autism, or are they talking to the parents knowing and accepting that their kids have autism?
I think it's a whole, with parents accepting the diagnosis and with people that are not knowledgeable about the diagnosis to become more aware and to accept it.
Okay, so tell us how you would go about diagnosing this.
Okay, so it's important to take a good history from the parents, start from pregnancy, go through the birth history, the developmental history, and you'll do a medical examination. It's always important to exclude a problem with vision and a problem with hearing, your basics. So when you take a history, always find out about a family history. So, I mean, back in the days, we didn't make a lot of diagnosis, but some parents will tell you that even if you go 3 generations down, that somebody wasn't speaking, had abnormal behavior. And also first degree relatives, is there history of autism? When examination, observe the child, see how the child interacts, what is the level of speech, how does the child interact with the parents, is the child making eye contact with you, when the child does speak, does the child use gestures while speaking. Neurologically, it's important to check for syndromes because we can get certain syndromes that can be associated with autism spectrum disorder. Genetics is very important. And screening tools. There are some screening tools, scientific screening tools that can be used to make a diagnosis.
Okay, and the all-important question, something that we get asked all the time, do vaccines cause autism?
Good question. So the answer is a big no. There's no evidence or link that vaccines do cause autism.
But then let me just stop you there.
Yeah, I wanted to ask for your opinion.
There are a lot of patients, a lot of moms and dads who, when they do find out the diagnosis, and you tell them that it wasn't caused by vaccines, when they're trying to find answers, they pull out a whole lot of references from the internet that show that it was caused by vaccines. Now, what do you say to a parent to that?
So the recent articles have disproved that vaccinations cause autism. I think when you approach such a parent, you need to explain the importance of vaccinating your kid because vaccines do prevent illnesses, and some of these illnesses can be life-threatening and lead to mortality of the child. So you need to explain the importance of vaccinations and vaccines being a preventative measure to prevent serious illness in the child, which can even lead to death of a child if not vaccinated.
So you heard it here from our experts that vaccines do not cause autism. What are some of the causes and risk factors associated with autism?
Yeah, this is also a question we get asked a lot by parents because they're not sure what caused it. Genetics plays a huge role. There's many genes involved, which could have an effect on the developing brain of the baby. And some common risk factors is the male gender, first degree relative, twin pregnancy. Screen time, less than 2 years. I don't advise screen time because it's been shown in studies when children watch a lot of screen time, they don't have that ability to communicate with other children or even their parents. And that can lead to a language delay. It can also affect their ability to sleep. So screen time has to be restricted.
That's an interesting one, screen time.
Yeah.
A lot of parents, parenting is not easy, right? So a lot of times when they need to just divert their attention, or if the child is misbehaving, they just give them the phone, put something on for them, and they occupy it for at least half an hour. So you're saying that that's not something that should be done?
Absolutely not.
Okay, right. And you spoke about the genetics. Is there any sort of genetic counseling or genetic testing that can be done during the pregnancy or before a pregnancy to see if you carry any genes for this autism? Is it something that is done here in South Africa? Is it something that's been promoted?
Yeah, so there's various genes that's contributing. There's a lot of them. There are some new genes as well. Remember, these tests can also be quite expensive and costly. So we are still doing more studies on it. But because there's so many genes contributing, it wouldn't be sensible, to actually find an actual gene that's causing it. I think the main concern is identifying these kids early and referring them for intervention, which is therapy, that's going to improve the outcomes of these kids.
So basically, there's no prevention for this. This is something that happens.
Yeah.
Okay. So it's just once it happens, it's just how to deal with it and manage it.
Acceptance.
Okay. So talking about acceptance and identifying, what are some of the early red flags that we see?
Yeah, red flags can be as early when baby is born. You will find that this baby is struggling to latch onto the mom's breast when the mom is attempting to breastfeed the baby. The baby may have abnormal sleep patterns. As the baby grows older and becomes an infant, there might be little eye contact. A common one is that they don't respond to the name when being called. They should respond to the name by around 6 months. And non-verbal communication, they don't wave goodbye. Then they have parallel play, which is basically they'll be playing next to a kid, almost doing the same thing, but not interacting with that kid.
So just mirroring what they're doing.
Just mirroring, yeah.
Okay. And I know it's very difficult to diagnose it firstly, but management is also quite difficult because of the multiple coexistence of conditions and things like that. So what's the best way to manage this?
Yeah, I think before I go to the management, I would just like to mention to our listeners that they need to know this, that there's no cure for autism currently.
There's no cure and there's no prevention.
Prevention, you can look at possible risk factors that's contributing and you can decide, but once a diagnosis is made, they need to be aware that there's no cure for it, but there is treatment, and early intervention can help the outcomes, the future outcomes. So there are medicines that's approved to treat the behavioral aspects of the autism, but they're not curing the autism. Autism spectrum disorder needs a multidisciplinary team approach. So we need to incorporate all of our healthcare professionals in the treatment. So a speech therapist is very important. They can help the child to improve communication and social skills. Some of them use pictures instead of words to communicate. Occupational therapy is so important because they help to evaluate the developmental levels of the child, the ability to self-regulate emotions. They can help with sensory issues because sometimes these kiddies get sensory overloaded and then they have meltdowns. They can assist with functional skills. One of the other things is fine motor skills and gross motor skills and daily living skills. So your occupational therapist is so important. Always get a dietitian involved because these kids can be fussy eaters due to the texture of food, the taste of food, and that can lead to malnutrition. They can have acid reflux. A lot of them have low fiber in their diets and they tend to be constipated. And the sad thing is that they won't be able to verbalize to you that the tummy feels sore. The dietitian can assist you with sensory sensitivities, with food aversions, mealtime routines, which is important because these children struggle with routines, and healthy eating habits and overall well-being. Psychologists can assist you with special assessments, ABA, applied behavioral analysis, and managing co-occurring conditions like your anxiety, your depression, and also speaking to the parents. Your pediatrician, pediatric neurologist, neurodevelopmental specialist, psychiatrist. We are here to follow up on the child, medical prescriptions if needed to treat the behavioral aspects, and then doing a medical exam frequently to look for the underlying problems like reflux, ear infections, constipation, to see if the child is growing well, etc., and that the child is doing well on medications. We should not forget teachers and caregivers. I think it's important to do awareness in schools as well, educating teachers and caregivers on this condition. Educating family members, so to break the stigma attached to the disorder. So educating family members, especially with young parents, new diagnosis, family members don't know what it is. So it's important to educate family members. I think more awareness programs will be important. A social worker to support families, and it's important to advocate for the needs of autistic children and connecting these parents to resources and services as needed. A lot of these kiddies are diagnosed in rural areas. They cannot afford services. Therapy is very expensive. Some parents, the amount of money that they need to pay for therapy is almost the whole salary. So it just goes for the treatment of autism, and they don't have cash for anything else. So it's important to get a social worker involved. And we should not forget the mom and the dad, because we often treat the child and then forget the parents, because they do have underlying mental health conditions after the diagnosis, and depression, anxiety is very common. And if the child is not sleeping, the parents are not sleeping, and it's also a problem.
Yeah, so it's important that there's a support structure available for the parents as well. And what is the usual medicines that are given to a child with autism, besides treating the symptoms like gastritis and things like that? Is it the same as what people use for ADHD, Ritalin and things like that, or is it contraindicated in this case?
Yeah, so we do use an antipsychotic medication that is approved to treat the behavioral aspects of autism. So it's always important to tell the parents what the medication is, what are the side effects, and why you're using this specific medication. It's not because you're treating a psychosis, but you're treating the behavioral aspects of autism. So medicine is advised if you are struggling with the behavior, but it's also important to tell them that it's not there to cure the autism.
Mm-hmm. And violence, is it very common symptom, or is it more out of frustration that the kids lash out, or what's your opinion on that?
These kiddies love routine. And if you change their routine, they will get upset. Also, sensory issues. They how do I put it? If they're non-verbal, and if they have sensory issues, like for example, hearing, if a sound irritates them, and if they're non-verbal, obviously they're going to manifest by a behavioral response, which will be a meltdown. Yeah, and that's different from a temper tantrum. In that a temper tantrum, a child uses it as a sort of manipulation to get what they want, of 2-year-olds, for example. A meltdown is a child's way of expressing, I do not like this, I do not like that light, I don't like the sound of the cars driving by, and they go into a meltdown. So allow that child to have that meltdown, be next to the child, reassure the child. Don't try to stop it. It's so important, and parents are struggling with meltdowns, because if they take their child to a mall, there's a meltdown, new setting.
So usually at what age would they start having these meltdowns?
It can occur, from 2 years going on, they can start presenting with the meltdowns. You see it a lot in the older kids as well. As they grow older, you can start to see these meltdowns. So it's important for people that's not so knowledgeable about the condition to understand what a meltdown is and why a child with autism has meltdowns. Yeah.
Okay, we're going to take a short break, and when we come back, we're going to start answering some of the listeners' questions.
This segment is brought to you by Kenfield Auto, your RMI approved service and repair specialist. 236 Brickfield Road, Overport. Kenfield Auto.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ربنا وجعلنا مسلمين لك ومن ذريتنا أمة مسلمة لك وأرنا مناسكنا وتب علينا إنك أنت التواب الرحيم.
Car won't start?
Kenfield Auto.
Noisy brakes?
Kenfield Auto.
Due for a service?
Kenfield Auto. Kenfield Auto, the answer to all your car problems. Your service and repair specialist for your VW, Audi, Suzuki, Toyota, or just about any vehicle. Kenfield Auto, your RMI and insurance approved workshop to handle them all. 236 Brickfield Road, Overport. Call us on 031 207 2399. Kenfield Auto. Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
A heartfelt Jazakallah Khair from the Al Ansar Foundation to one and all for another inspirational Ramadan, and the spirit of giving and generosity once again shone brightly. As we celebrate the spirit of giving and compassion, we acknowledge the generosity of our donors and sponsors who have made our Eid feeding scheme a success. We extend our deepest gratitude in no particular order of value contribution to Pale Pack, Willerton Group, Abba Musa Wholesalers, Golden Delight, Gold Keys, Frimax Foods, Capital Group of Companies, Checkers, Cowie Park, Osman's Taj Mahal, Tradeport Durban, Jamadar's Wholesale, Denson's Peter Maritzburg, Crescent Girls High, Orient Islamic School, Atomic Demolishers, and our volunteers and well-wishers, and to all our kind-hearted donors from Radio Al Ansar, be it in cash or other initiatives. We also wish to make a special supplication for the donors that made significant contributions but wished to remain anonymous. Your contributions have brought joy and nourishment to those in need. May your kindness be rewarded abundantly. Feeding in any form to a constituency of any people is amongst the noblest and highly rewarded acts of ibadah. We wish all our communities a blessed Eid Mubarak. The Al Ansar Foundation, educating, uniting, informing, uplifting.
Audio stream across the world on radioalansar.co.za.
Welcome back to Medical Files. I am your host, Dr Arshad Bhayat. For those of you that have just joined us, we are speaking to Dr Mark Moodley, a pediatrician, here in the studio with us today, and we're discussing autism and the autism spectrum. We have a few questions here. For those of you that haven't sent in your queries or questions, you still have time. You can send it through on 060-904-1056, 060-904-1056. Any question that you may have had, disregarding this topic of autism, please send it through to us, and our expert in the studio will answer it. Doc, we discussed most of the things here, and this is a highly complex condition when it comes to clinical presentation, also when it comes to making a diagnosis, and also in the management. One or two questions coming in here from our listeners regarding this. Just to sum it up, basically what they're asking is this something that can be outgrown, outgrown, and at what's the age expectancy, how old can they live up to? Can they live a normal length of life, or does this shorten one's life?
I think that all boils down to early identification and early referral for treatment, which is therapy, because studies and evidence-based medicine has shown that the earlier the intervention, the better the outcomes of the child. All children are different, and we don't know what the outcomes will be in the future. But if you intervene early, outcomes can be better, and these children can have normal lives, normal relationships, work, and, be successful in life,
I see there are a lot of adverts that you find for centers or educational centers that give care and things like that. Is that something that's common, or something that you should do, or is it more important that the parent takes responsibility and stays with the child at home and helps out?
I think it's up to the parents on what they want to do. We can counsel parents and speak to them and explain to them what the diagnosis is. But parents also play a role in the management. So it's a shared decision making when it comes to management.
Okay. Another question coming through, basically wanting to know, is it possible for a child diagnosed with autism to grow up and lead an independent life?
Yeah, it is possible. If you intervene early, like I've said, with our research-based medicine, outcomes can be better. So early referral to speech therapy, occupational therapy, frequent follow-ups to your doctor can have good outcomes in children, and all children are different. So early intervention is a key point that I'm trying to get across.
Okay, and then another question coming through. If my firstborn has been diagnosed with autism, is there a chance that my following pregnancies could also have kids with autism?
Yeah, so autism, we said the causes is mainly genetic. So if your first kid is diagnosed with autism, then there is a risk of the next child having autism.
Okay. Another question coming through. If the child is left undiagnosed and just treated as a child that's not behaving themselves and is beaten, what would the usual outcome of that child be?
If the child is, like I said initially on the show, in South Africa, we are limited. So it's not really about actually making the diagnosis, but if you're suspecting it, refer that child for intervention, which is going to be your speech therapy and your occupational therapy and psychology. Start the intervention. You have nothing to lose, whether the diagnosis is made or not. If you start therapy, you have started the work for autism spectrum disorder.
Okay. Another question. What is the best way of dealing with the child's meltdown?
So this question, it's good to actually ask parents that's walked the journey for years. I do have parents, children are 15 and 16 now, and they all have a variety of methods that they use. But don't scream and shout at the child. Allow the child to have the meltdown.
That's the worst thing you can do, is to scream and shout.
Yes, Doc, that is the worst thing you can do. Reassure the child that everything's okay. Be next to the child. Sometimes when they come out of their meltdown, they feel ashamed of what they've done. So be with the child, understand what the child is going through, keep reassuring it's going to be okay. And take it from there, and try and avoid precipitating factors like a new setting or sensory stimulation. You will know your child and what are the triggers for a meltdown. So try and avoid some of those factors if you can.
Would it be a good idea to prevent the child from interacting with other people, like in a social setting, like going to the supermarket, going to a flea market, things like that? That's another question that's come through.
No, I don't think you should prevent that child from going out. I was actually reading a quotation that said, for parents that have children that's not on the spectrum, no child is normal. So let's break the stigma and take the child out. And as parents, be assertive about your children. We are all one, and neurodivergent children, they're beautiful as well. So we need to accept.
Okay, so we've almost come to the end of the show. Give us some final words of wisdom from your part there, Doc.
Doc, it's actually some good sayings that I found. So the first one is, it takes a village to raise a child. It takes a child with autism to raise awareness of that village. The next one is from a very famous speaker on autism. She is autistic as well. She said, "I am different, not less." There's another one. Do not fear people with autism, embrace them. Do not spite people with autism, unite them. Do not deny people with autism, accept them, for then their abilities will shine. And the next one is, if you've met one person with autism, you've met one person with autism. And the final one is, the most interesting people you find are ones that don't fit into your average cardboard box. They'll make what they need. They'll make their own boxes. And last one, autism is like a rainbow. It has a bright side and a darker side, but every shade is important and beautiful.
All right, so there you have it. Great words of wisdom there from our pediatrician and expert on behavior, Dr. Mark Moodley, who has been with us here in the studio for the last hour or so, answering your questions and discussing what is a very complex spectrum, something that's very common nowadays as well, something that's going undiagnosed quite a bit, and even the management sometimes is not that's up to par. And we need more of these types of, I wouldn't say motivational, I say because awareness is there. I think now they just need to be motivated to act on the awareness now. I'd like to thank you, Dr. Mark Moodley, for your time, and for all those out there that are suffering from any types of diseases or sickness. We make dua that Almighty Allah grants complete shifa to everybody and gives them full cure. I'd like to thank my tech for today, Monday. I'd like to thank the Islamic Medical Association and my guest, all the listeners. We were live on Facebook and on YouTube. I would like to thank all those that participated there as well. We hope to have you back with us next week. My colleague, Mr. Suleiman, will be hosting the show next week. We take turns, alternate turns, and we pray that Almighty Allah keeps you in good health. From me, your host, Dr. Arshad Bhayat, we wish you a pleasant evening. Assalamu alaikum wa rahmatullahi wa barakatuh.
Getting you through your day. Radio Al Ansar.